is the connection between hiatal hernias and not only the neurophysiology, the heart issues he's talking about, but also the bloating, the pain, the back pain, and the connection between hiatal hernia and back pain is so prevalent. And there's a reason for it. First of all, the nerve supply from the spine and the back go to not only the stomach, but the lower esophageal sphincter, all the muscles in the diaphragm, all of that, the abdominal muscles, right, all interconnected. But then also the diaphragm is connected to your ribs, okay? These ribs right here, right through here. Okay, 12, 11, 10, 9, 8, 7, okay? And they're all connected to the rib cage. So those fibers, a lot of people don't talk about back pain and hiatal hernia, and they're linked. We have one patient that just wants the hiatal hernia maneuver done, and his progress is much slower because we're not addressing the rib cage. He just doesn't want to be adjusted for whatever reason. So, the connection there is really important, you know, and you've been to heart doctors, you've been to all sorts of doctors over the last 10 years. I understand the frustration, and they want to put you on heart medication or blood thinners, things like that. And oftentimes the answer lies with the vagus nerve, and the vagus nerve creates or controls your heart rate variability, and that can control or cause the panic attacks, the heart palpitations, okay, and other heart issues. It can mimic that. So if you correct the hiatal hernia, work on the thoracolumbar junction where the thoracic spine meets the lumbar spine, so that's like your upper low back or your lower mid back, I guess some people would call it, right? That area is really important to address. And you'll see here I'm doing laser on Vitaly. So this laser is just going to help reduce the muscle spasms, some of the pain in his thoracolumbar junction. We're then going to loosen up the muscles where the ribs meet the spine, okay? And once we loosen up the costovertebral junction there, the muscles alongside of the spine, then of course, we do the hiatal hernia maneuver. We adjust his thoracolumbar spine. Sometimes ribs have to get adjusted. Sometimes the psoas muscle has to be released because the upper fibers of the psoas muscle attach to the diaphragm, okay? The diaphragm also attached to the ribs attached to the thoracic spine, and so it's all connected. And then you have the vagus nerve in there that creates the heart palpitations, and then also it doesn't just control heart rate variability, but it controls production of acid. It also controls the lower esophageal sphincter muscle. So if there's pressure on the vagus nerve, then the sphincter can't close strong enough. So it's all interconnected. It's like a cat chasing its tail, right? The whole condition. And you have to get to the source, the cause of the acid reflux and the GERD and the other symptoms you're having by pulling the stomach down. And the longer you've had the condition, the harder it is to pull down. But that doesn't mean it can't be done. It can be, and it will be. Just got to give it time and have everything addressed, not just the maneuver done. If you're doing the maneuver and it helps a little bit, but you're not getting complete resolution, the other part you're missing is probably mobilization of the diaphragm, the ribs, and the thoracolumbar spine or psoas, that whole connection. And for every patient, that's different. But for Vitaly here, you can feel the stiffness in his thoracolumbar spine, and when I push down, well, before I did the laser, let's see, I haven't done the whole spine, so but a little better. Well, he was moaning a little bit when I pushed down here in this area. It seems to be a little bit better. We've done some laser on one side, but he's sore at that upper lumbar L2, L1, T12, T11, T10, T9 area, and that's what we're focusing on right now. So next after this does a lot for soft tissue, the laser therapy. It just helps speed the process up, and then I'm going to go in here and do some manual therapy work to loosen up where the ribs meet the thoracic spine, mobilize that more, and then adjust it. Okay, so you guys can watch this process and how we do this. And thank Vitaly for allowing us to film this, because not everybody, wants to be filmed, number one. Number two, it's a sensitive subject for people. People are suffering from this and not getting the proper answers and the proper health. And the reason being is GI docs don't study the neurophysiology. They just know the esophagus and the stomach, right? And endoscopies, and some may do the surgeries, right? And not taking anything away from them, but the testing, the endoscopies, the barium swallows, those are at best 40 to 50% effective. So a lot of people hang their hat on that diagnosis from the endoscopy or barium swallow. You don't need to do that. If you're having any one of those major, actually 2 or 3 of those symptoms that I have mentioned in all my other videos, then you most likely have a hiatal hernia. And all you have to do is try the technique, pull the stomach down. If you feel or see some change after doing it repetitively, 5 strokes in the morning, 5 strokes again at night. If you notice changes, even if they're slight, especially it might take a few weeks, but if you notice those changes, then you're on the right track. Then you know you have a hiatal hernia, and you don't need a test to tell you that you do or don't, because again, those endoscopies are 40 to 50% accurate. That's lousy. It really is. It's not good. So don't hang your hat on that. Just go by your symptoms. Cough late at night, or when you lie down, or during the day, like you have to clear your throat a lot. Globus, like there's a pit in your throat. Difficulty swallowing food, it gets stuck in the throat. Difficulty getting a full breath. Bloating, a lot of burping, belching after you eat. Stomach pain in the upper stomach area can radiate to the rib cage. It can even radiate to the back pain, mid-back pain. And heart palpitations, panic attacks, high anxiety, things like that. Those are some of the common or less common symptoms that the GI doc and the cardiologist will not make the connection to the hiatal hernia. And then also the mid-back pain that people are kind of missing, or it could be just mid-back tension. You have to address that for full resolution so that you reduce the risks of it reoccurring again. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like, and don't forget to subscribe. Appreciate you guys.